So let's get into the definition and the etiology of it. So compartment syndrome is a condition in the extremities that builds pressure to extremely dangerous levels. The pressure can decrease blood flow, which prevents nourishment and oxygen from reaching nerve and muscle cells. So compartment syndrome can be either acute or chronic. Acute compartment syndrome is a medical emergency. It is usually caused by a severe injury. Without treatment, it can lead to permanent muscle damage. And chronic compartment syndrome, also known as exertional compartment syndrome, is usually not a medical emergency. It is most caused by athletic exertion. So let's get into the etiology of it. Compartment syndrome develops when swelling or bleeding occurs within a compartment. Because the fascia does not stretch, this can cause increased pressure to the capillaries, nerves, and muscles in the compartment. Blood flow to the muscle and nerve cells is disrupted. Without a steady supply of oxygen and nutrients, nerve and muscle cells can be damaged. All right, now let's take a look at pathophysiology of compartment syndrome. So when fluid enters a fixed volume compartment, for example from bleeding, both the tissue and venous pressure increase. When this exceeds the cerebral perfusion pressure, also known as CPP, capillary collapse with ensuring muscle and nerve ischemia occurs. A similar reduction occurs in CPP when the compartment size decreases, for example, external compression, due to an increase in intercompartmental pressure, as well as reduction in the arteriolar pressure. Compartment syndromes can arise in any area of the body that has little or no capacity for tissue expansion. So now let's take a look at the cross-section of the leg, made by me, and see what the compartment syndrome looks like.
This is a cross-section of a right leg. It shows all the compartments and muscles of the lower extremity. I made the outside part of the sculpture the skin, and just inside the skin is the fat of the leg. This is the tibialis anterior. It dorsiflexes the ankle and inverts the hind foot. It also dorsiflexes foot in preparation for heel strike and eccentrically contracts after heel strike. This is the extensor hallucis longus. It extends great toe and dorsiflexes ankle. This is the extensor digitorum longus. It extends the toes 2 through 5 and dorsiflexes the ankle. This is the peroneus longus. It everts the foot and plantar flexes the ankle, and also helps to support the transverse arch of the foot. This is the peroneus brevis. It everts the foot and plantar flexes the ankle. This is the flexor hallucis longus. It flexes the great toe, helps to supinate the ankle, and is a very weak plantar flexor of the ankle. This is the tibialis posterior. The principal inverter of the foot also adducts foot, plantar flexes the ankle, and helps to supinate the foot. This is the flexor digitorum longus. It flexes the toes 2 through 5, and it also helps in plantar flexion of the ankle. This is the soleus. This is a powerful plantar flexor of the ankle. This is the gastrocnemius medial head and lateral head. It is a powerful plantar flexor of the ankle. Now we're at the tibia. This is the main bone of the lower leg, forming the shin. And this is the fibula, the long bone that is located just behind the tibial head at the knee joint. As you can see in the next sculpture, the compartments of the leg have expanded, and the fat around the compartments have compressed. Also, the compartments are darker than that of the normal cross-section, and there are divots in the muscle. This is an example of what a cross-section of a leg looks like in acute compartment syndrome.
Wow, wasn't that cool? Okay, let's move on to clinical manifestations. So when we discuss about manifestations of compartment syndrome, we were reminded of the 5 P's. These 5 P's are pain, pallor, also known as pale skin tone, paresthesia, also known as numbness feeling, pulselessness, also known as faint pulse, and paralysis, also known as weakness with movements. Some other manifestations of compartment syndrome include tenderness and tightness in the muscle, burning sensation, and tingling. All right, let's talk about some diagnostics and some testings. So first what we're going to look at is compartment pressure testing. And that measures the amount of pressure within the muscle compartment. To perform this test, a doctor first injects a small amount of anesthesia into the affected muscle to numb them. He or she inserts a handheld device attached to a needle into the muscle compartment to measure the amount of pressure inside the compartment. Next, we'll look at imaging tests. And these rule out other causes of exercise-related pain that have similar symptoms. An X-ray or MRI scan, which create detailed images of the inside of the body, may reveal evidence of a stress fracture or tendinitis. And the last one we're going to talk about is pressure meter test. Your doctor may also use this with a needle attached to measure how much pressure is in the compartment. This measurement needs to be taken while you're doing the activity that makes your leg or arm hurt. It will be taken again after you've finished. And lastly, we'll look at the treatment modalities of compartment syndrome. According to healthline.com, surgery is the only treatment option for acute compartment syndrome. The process involves making an incision into the fascia to reduce pressure in the compartment/leg. In more severe cases, the medical team will have to wait for the swelling to go down until closing the incision back up. Some of these severe cases involve skin grafting, which is a procedure where you can remove skin from one part of the body and move it to that specific spot. With chronic compartment syndrome, your doctor may recommend non-surgical treatments, including physical therapy, anti-inflammatory medication, elevation of the extremity, resting, and ice. If none of these work, the next option would be surgery, which is generally more effective than non-surgical procedures. Now you know all there is to know about compartment syndrome. I'm just kidding. But let's do some questions and see what you've learned.
All right, let's do some questions. The nurse is caring for a client who develops compartment syndrome for a severely fractured arm. The client asks the nurse how this can happen. The nurse's response is based on the understanding that A. A bone fragment has injured the nerve supply in the area. B. An injured artery causes impaired arterial perfusion through the compartment. C. Bleeding and swelling cause increased pressure in an area that cannot expand. And D. The fascia expands with injury, causing pressure on underlying nerves and muscles. I'll give you a couple seconds. Pause the video if you need to. All right, the correct answer is C. Bleeding and swelling cause increased pressure in an area that cannot expand. Compartment syndrome is caused by bleeding and swelling within a compartment, which is lined by fascia that does not expand. The bleeding and swelling place pressure on the nerves, muscles, and blood vessels in the compartment, triggering the symptoms. All right, question number 2. A client who has sustained a crush injury to the right lower leg reports numbness and tingling of the affected extremity. The skin of the right leg appears pale. Which is the nurse's first intervention? A. Assess pedal pulses. B. Apply oxygen by nasal cannula. C. Increase the IV flow rate. Or D. Document the finding. I'll give you a couple seconds. Pause if you need to. All right, the correct answer is A. Assess pedal pulses. The symptoms represent early warning of acute compartment syndrome. In acute compartment syndrome, sensory deficits such as paresthesia precede changes in vascular or motor signs. If the nurse finds a decrease in pedal pulses, the healthcare provider should be notified as soon as possible. All right, third and final question. The nurse is caring for a client with a fractured fibula. Which assessment prompts immediate action by the nurse? A. Reported pain of 4 on a scale of 0 to 10. B. Numbness and tingling in the extremity. C. Swollen extremity where the injury occurred. Or D. Report of being cold in bed. Again, I'll give you a couple seconds. Pause if you need to. All right, the correct answer is B. Numbness and tingling in extremity. The client with numbness and tingling of the extremity may be displaying the first signs of acute compartment syndrome. This is an acute problem that requires immediate intervention because of possible decreased circulation. Moderate pain and swelling is an expected assessment after a fracture. These findings can be treated with comfort measures. Being cold can be treated with additional blankets or by increasing the temperature of the room.
This has been my presentation on compartment syndrome. I hope you all have a great day, and thank you so much for watching.